Hello, my name is Megan Sheppard, and I'm the Health Officer for the Cumberland County Health Department. And we would like to provide an important update on the coronavirus or COVID-19 situation in Cumberland County. We have been and will continue to work diligently with our state, county, and local partners to ensure that we are prepared and planning correctly for this virus. I have been impressed so far with the support we have received from our townships and cities, our Board of Health, and our Board of Chosen Freeholders. And this includes the City of Vineland. They have their own health department, and we have been working very closely with them during this entire situation. It's very hard to go anywhere nowadays without hearing something about COVID-19. For local information, though, we are encouraging our citizens to look to your local health departments, including the Cumberland County Health Department and the City of Vineland, for local resources on learning how you can prepare and plan for your family and friends. But two things we would like to update our communities on are social distancing and testing for COVID-19. Social distancing is a proven strategy that helps stop and slow the spread of disease. This virus in particular spreads through droplets in the air. So when someone coughs or sneezes on a desk or doorknob, and then you touch it, and then you maybe put your hands in your mouth, you have now infected yourself. When you minimize close contact with others, you lessen your chance that you will catch the virus and spread it to others in the community. Although it's estimated that 80% of these cases will have mild to no symptoms, it's important we still implement social distancing to protect those vulnerable populations, including our older population and those with immune-compromised systems. You're also keeping our healthcare system intact, whether you realize it or not. If everyone is sick at the same time, it puts a major stress on our healthcare system and reduces their ability to provide other usual and necessary medical care for the entire population. Regarding testing, not everyone is being tested, and this is why. You have to meet certain criteria to even be tested, and the major criteria is you have to be symptomatic, and since symptoms must be consistent with COVID-19. Regardless of if you had contact or if you had contact with a contact of a confirmed patient, you still need to be symptomatic. Regardless of whether you're a confirmed patient or not, or just ill, the recommendations are the same. Self-isolate, stay home with sick, and wash your hands often. There is no current treatment for COVID-19, although they are working on finding a treatment option, as well as possibly creating a vaccine for the future. It's common during public health emergencies for supplies being a shortage. You don't know when it's coming, what kind of virus it is, or how it's going to be introduced, or what the priority population will be. It takes time to figure things out, especially how to treat it, and how to prevent it, and how to test for it. Nationally, there is a shortage of testing kits, as well as protective personal equipment, like masks that they wear in the healthcare and your healthcare provider's office. In order to get tested, you will need a script from a doctor. So you will need to see a doctor, have them assess you, and then believe that you meet the criteria to receive testing. Some doctor's offices are going to be able to provide that testing for you. Although remember, testing kits are in a shortage, as well as PPE. If they cannot test you and they believe your symptoms are just mild, we're asking our residents to just heed the recommendations of their primary care physician, which will probably be stay home and self-isolate, stay home and sick, do not go out in public until you're not sick anymore, and wash your hands often. If you are severely ill and require hospitalization, and in order for the doctors to diagnose you properly, they may test you. They need to know how to treat you and get you better so they can release you from the hospital. We're asking all of our residents to stay up to date on information. We have updates on our social media sites daily. We have information on our websites, the Cumberland County Health Departments, the County of Cumberland, the City of Vineland's website, and social media pages as well. You can also find many resources through the CDC and the New Jersey Department of Health's website. We as health professionals look to the CDC daily for guidance and education materials, and all of these materials are accessible to the entire population. We need to work together to keep our community safe and healthy. So we are asking everyone to heed the recommendations of the governor's direction and our health officials. Thank you.